Hello, so for today's video, we're going to perform an ECG. Before we proceed to ECG, we need to check all the materials needed, especially the machines if it's still working and the leads if it is complete. Next, we need to confirm the patient's name. Sir, can you please state your name? After confirming the patient's name, we can now proceed to obtain informed consent to the patient. So, I am Elmer Benavilo, a health provider, and according to your doctor, we need to perform an ECG to know the level or the rhythm of your heart. After informing the patients, perform hand hygiene or hand washing. And we can now explain the procedure to the patient. So, sir, alanda ka ti EKG, tapno, makita tayo di heart rhythm mo. No, mayat, we know that is something wrong di the heart rhythm mo. So, sir, awan man ti jewelries mo? Awan man ti coinzetable bulsang, sir? Ano ta wallet mo? Sir, awan man ti metal di tao nagtibagin, sir? Awan? Sure ka, sir, nga awan? Okay. Before we proceed to performing EKG, we need to dry the skin of the patient using gauze. Place your patient in supine position. So since my patient is in supine position, we cannot perform that anymore. Then we can now insert or put the electrodes. First on the chest limbs. So now we can now put the chest leads. So first, red on the right fourth intercostal space. So we need to count 1, 2, 3, 4. Next one is the yellow on the left fourth intercostal space. Again, we need to count 1, 2, 3, 4. Next one is the blue on the fifth intercostal space. One, 2, 3, 4, 5. Now we can insert the V3 or the green between the yellow and blue leads. Now we can now put the V5 or the brown on the anterior axillary line. And lastly, the violet on the axillary line or on the armpit. After placing the chest leads, we can now proceed to the limb leads. First, yellow on right arm. Green, right leg. Red on the left arm. And lastly, black on the left leg. Sir, kagot puti or ag-relax ka lang kay 10 to 15 seconds ta lantangan na laing data EKG mo. After informing, press the right button on the EKG machine. After getting the EKG rhythm, if you are satisfied, we can now remove all the leads. And to the result, we need to indicate the patient's name, the date of birth, the place of birth, and the date today. Chief complaint. Disconnect all the electrodes. Then perform hand hygiene.